नमस्कार. हमेशा खुश रहो बिटिया. Me, myself, Dr. Ramesh Chand Sharma, Associate Professor and HOD, Department of Forensic Medicine and Toxicology, Faculty of Homeopathic Science, JVW. Today's our topic is delivery. Delivery is defined as a process by which there is expulsion or extraction of the child from the uterus with or without external help. It may be spontaneous or induced. General appearance of indisposition. The woman look pale and sick with shrunken eyes for the first 2 3 days. Presence of dark colored pigmentations over the lower eyelid. Pulse and body temperature are slightly raised. Changes in the breast. Breasts are full or prominent, having a knotty or nodular feelings and tender. Nipples enlarged, surrounded by darkened areola and Montgomery tubercle. Nipples on squeezing yield milk or colostrum. Abdominal changes in the abdomen is lax, flabby, and the skin over the abdomen appears wrinkled. Strigavidum, linea albicans, and linea nigra are seen due to overstretching of the skin over the abdomen during pregnancy. Intermittent painful uterine contractions are felt by the patient for 4 to 5 days. The uterus gradually diminishes in size at the rate of 1.5 centimeter per day. On sixth day, the height of the uterus is midway between umbilicus and the pubis. On 14 days, fundus is at the level of pubic symphysis. The uterus comes back to normal positions by ninth week. Changes in labia majora and labia minora. Swollen, tender, bruising, and lacerations of the labia may be present. Fossa navicularis and posterior commissures shows tears which may extend up to perineum in primigravida. Changes in the vagina. Vagina is spacious with loss of rugosity and the walls are relaxed. May show recent tears which heals by 7 days and rugi appears in about 3 weeks. Changes in the cervix. Cervix is soft and patulous. Internal os close by 24 weeks and the external os appear soft and admits 2 fingers. After 1 week, the external os admits on fingers with difficulty and it closes by second week. Lochia. It is a discharge from the vagina which is present for a period of 2 to 3 weeks after delivery. It has peculiar disagreeable odor. It gradually changes in color and consistency. Lochia is of 3 types depending on its color. Lochia rubra. It is bright red containing blood clots. It is thick in consistency and is present for the first 4 to 5 days after delivery. Lochia serosa. During the next 4 to 5 days, the lochia changes in color and appears zero. The consistency becomes gradually thin and pale. In the lochia alba, from the 9 days onwards, the color is yellowish gray, which becomes white and turbid and finally disappears in 2 weeks. Laboratory finding. Urine shows presence of HCG even after delivery. It can be detected in traces up to 2 weeks after delivery. Sign of recent delivery on in living. Extent of sign depends upon whether the woman is primiparous or multiparous, breast is pendulous, hyperpigmentation present, Montgomery's tubercles are prominent, striae are present, abdomen wall is lax, linea albicans, linea nigra, sign of recent delivery in the dead. All external sign and local signs seen in living persons can be made out. In addition to that, on internal examinations, the uterine walls appears 4 to 5 centimeters thickness. Uterine cavity is obliterated by oppositions of anterior and posterior walls. After 6 weeks, thickness of the uterus is about 1 to 2 centimeters. In the remote delivery in living and dead, externally abdomen, legs, and flabby linea albicans present in all the cases and hysterectomy gravidum may be seen in some cases. Breast. Breast will be soft and pendulous. Nipples are larger, darker, and appear raised. Areola is dark with Montgomery tubercles. On palpation, the breasts are nodular in consistency and in some multipara. Striae may be present on the surface of the breasts. External genitalia. Labia majora is dark and are not in close opposition with each other. Labia minora is pigmented dark and protrude out through the gap in between the two sides of labia majora. Porcate and posterior commissures may show lacerations. Vagina is look capacious, dilated, and the wall appear relaxed. Hymen is absent and represented by the carunculi multiformis suppositious child. A woman presents a child as she is said to have delivered the child, but the fact is that she is not delivered any such a child. Examinations of the female for sign of recent delivery and the DNA analysis will be helpful to sort out this type's issue. In the legal issues, the inheritance of property, blackmailing email when a widow claims higher compensations from her husband's employer, bringing a charge of breach of promise of marriage against a man who is alleged to be the father of the child, abandoning an infant. Section 317 IPC abandoning a child of less than 12 years by the father, mother, and caretaker shall be punished with imprisonment up to 7 years. Concealment of birth. Section 318 IPC whoever intentionally conceals the birth of a child, either dead born or stillborn, and buries or disposed by other means shall be punished with imprisonment up to 2 years. Thank you.